3, 2.
Good afternoon, everyone. Thank you so much for joining us today. My name is Jennifer Hearn. I am the Strategic Operations Officer in the Office of the Deputy Governor, but today I'm here wearing my hat as the co-chair of the Deputy Governor's 5K Challenge. I'm very excited to be here today to officially launch the 2020 edition of the DG 5K, and I'm going to turn it over to the Honorable Deputy Governor, Mr. Frans Manderson, MBE, Certificate of Honor, to announce this year's dates and the beneficiary charities for this year's event.
Thank you, Ms. Ahern, and good afternoon, everyone. I'm sitting here today extremely proud of what we have achieved together with the Deputy Governor's 5K Challenge. We are now in our 7th year. We have raised over $300,000 for some amazing charities. I think this is really what Cayman is all about. Everyone coming together, caring about our community, caring about each other's success, getting healthy. There's nothing better than that. There's no downside to the DG's 5K Challenge. If you've been to the event, you feel the energy, you feel the passion, and you feel, like I said, what Cayman is all about. So today my job is very simple. I want to announce the dates. So I'm pleased to say that we're back in all 3 islands. Last year when we moved the date to September to accommodate Carifta, it wasn't great for Little Cayman because they closed down during the slow months of the year. But this year we're back, and on April 5th we'll be in Cayman Brac. On April 19th we're back in Little Cayman. And they have promised us some chocolate croissants again. And on April 26th, we'll be for the big event here in Grand Cayman. So again, I'm asking everyone to come out and be part of the DG's 5K 2020. I want to say, before I announce the charities, to do a very special thank you to Ms. Ahern and all of the planning committee who does a tremendous job to ensure that the event is run smoothly. And Ms. Ventisha, Ms. Cara, Ms. Nancy, everyone really works together to make this a fantastic event. Our charities. So each year, I think very carefully. We get some requests coming in, and I look to charities that are highly reputable and really make a difference in our islands. And I'm so pleased to say that this year, we have chosen the Cayman Islands Cancer Society, the Alzheimer's and Dementia Association, and the Cayman Islands MS Foundation. And now I'll turn it back over to Ms. Ahern so we can hear from the charities.
Thank you very much, Deputy Governor. I think another really exciting piece of news that we have today as well is that we have Applebee on board again as our platinum sponsor. They have sponsored this event since our 2nd year. They've been our platinum sponsor every year that we've had that opportunity. So we really want to thank Applebee for coming on board once again this year and supporting the event in a very big way. So as the Deputy Governor mentioned, we've got 3 fantastic charities that are going to be the beneficiaries of this year's event, and I'm going to introduce you to all 3 of them. From Adasi, we have Miss Dorothy Davis. She's the founder and chairperson of the Alzheimer's and Dementia Association of the Cayman Islands. From the Cayman Islands Cancer Society, we have Dr. Suk Yin, MBE, Certificate of Honor, who is the medical advocate with the Cancer Society. And from the MS Foundation of the Cayman Islands, we have Lisa Tatsosian, who is a senior board member. And I'm just going to ask each of the charities to tell you a little bit about the work that they've been doing, starting off with Miss Dorothy from Adasi.
Thank you very much. It's a pleasure to be here, and extremely, can't stress how extremely grateful we are to the Deputy Governor's 5K Challenge that we are being part of this wonderful event. Just want to say a bit about our charity. We started the association back in 2011 as a support group, and then we were registered as a nonprofit organization in 2014. We saw the need we know that there were persons living in the community with dementia, and I say dementia because that's one of the Alzheimer's is one of the dementia, and my mom was diagnosed with it, hence the reason I started the charity, and I needed support mentally to be supported by someone because I know the challenges that we were going through dealing with my mom. And therefore, I led from there, did my research, and then I was invited to the UK to start up this organization here. And I must say that we've been going since then. We don't do a lot of things. We do things, fundraisers publicly, but a lot of our things that we're done are more private events, because there's the stigma with a person with dementia, and either the individuals don't want anyone to know that they're suffering from Alzheimer's, or the family members, or whatever. And since our association with our World Alzheimer's Month, which is September of every year, we have been working very hard to get rid of the stigma, and we're doing it. We're taking baby steps, but it's happening because people are talking more about the disease, and more people are going out, taking their loved ones out, whereas restaurants, shops, or wherever, you're seeing more of that happen. With one of our initiatives one of our programs that are going very, very well is what we call the Memory Cafes. Every month we hold a Memory Cafe, and we have about 25 to 30 individuals. We hold it island-wide, so we go West Bay. The last one was in West Bay. We just had one in West Bay last week. And the individuals will come out. We have story time. We do things to get them active, moving, because we don't believe in them being, having a sedimentary lifestyle. Hence the reason the deputy governor is moving mentally and physically, get them being active. And that's one of the things we advocate for caregivers. And we do crafts and arts and crafts with them once every month, and that is a program that's been going for 2 years. We also do the respite program. We do support for the caregivers, and also the caregivers, paid caregivers, and the family members. And we do one-on-one consultation once they've been diagnosed with the individual or the family members. And we also give financial support where there's needed for a respite program. And respite care is where we have some individuals who don't have the financial needs to get a caregiver. They need care 24 hours a day, and they might only be able to afford one. And so then we get that one that's burnt out. Then there's a possibility of the abuse that's been reported to us. So we will go in and say, this caregiver need to take a break, and then the respite will step in.
Great. Well, thank you very much. Some really important work that Adasi is doing in the community.
Thank you.
And it's great to have you on board, one of our beneficiaries this year.
Thank you. It's a pleasure.
And now, next, I'm going to invite Dr. Yin from the Cayman Islands Cancer Society to tell us a little bit about the Cancer Society's plans for the proceeds from this year's event.
Well, again, big thanks, and really, really privileged, to be sitting here among these other charities who have been chosen. And thank you, DG, and also Ms. Jennifer, for selecting us to be one of the recipients. We have been the recipients of DG Run for a number of years in the beginning, and now this is our special year because this is our 25th anniversary, Cancer Society anniversary, as a registered company. Of course, we had Hope, who has worked here before. She was the start of the whole Cayman Islands Cancer sort of group, support group. So everybody started as a support group. So you will grow as we have grown, and we will grow and mature. And again, in the old days, Dorothy, when you mentioned the word stigma, cancer was a big stigma. All right, and we live back through the times when just the same thing. Nobody wants to go out when they've got cancer because just in case somebody knows that they've got it. They're ashamed, they're embarrassed, thinking it's because they have sinned in the past. But now we talk about it. And it takes time to do it, but people are sensitized to it. Now they are almost proud to tell people, I've got cancer, but I can beat it. So this is what will bring me to, I think, a lot of our programs you all know about, which will be the financial aid program. DG mentioned, he raised $300,000, but that's only a tip of the iceberg, what we have spent actually the last 2 years on financial aid program, where insurance could no longer cover it. Some people actually don't have insurance. Some indigents actually have sold their property and have nothing to live on. So with this big financial aid program, we actually help people pay for rent, pay for their sort of support of their children, even sometimes having the aid to them to continue with the insurance payment because they're out of a job. And most of the time, the businesses can't afford to keep them going because cancer treatment, as you know, can go over 18 months or a year. So this few years that we have been doing this financial aid, it has been getting bigger, and a lot more people know about it. But more importantly, is what is happening is that people are living longer. So don't look upon it as, oh my God, everybody here has more cancer. You look upon it because all this new treatment, CT scans, PET scans, we can do them here. And again, a big shout out to our partners, HSA, Chrissy Tomlinson Hospital, Baptist PET Scanner, Health City. They are brilliant when we ask them, please, can we have a voucher to do this CAT scan? Give us a discount because these people have no insurance. So these are all our supporters. And again, with other charities, reach out because nobody will deny you if you're doing a good job and they know you're honest about it. So I think accountability is extremely important. And then just to be very special about this year for me, the 25th years, because 10 years ago, we again partnered with the Public Health Department and also the Ministry of Health to actually launch what we call this Gardasil HPV preventing vaccine. At that time, it's a very new vaccine. We were in touch with CARPHA, WHO. We always, anything that we launch in terms of vaccinations or treatment or detection, we always make sure we use the national agencies, cancer agencies, to say this is a backup, this is really researched well enough, so that you can actually use this as part of your program. And now, 10 years later, some of these girls actually come to my clinic and say, you know, we're so grateful for you, Dr. Yin, and Cancer Society and the ministry, because we are the first batch of girls who got vaccinated. So as a special dedication to this vaccine, now you're hearing more about vaccines. I think you'll feel safer about it. Everybody's rushing to get the coronavirus vaccine made. So people have much more sort of, trust that we're not using the vaccine to damage anybody, but there to prevent something. So we're going to actually launch this in partnership with DG funds that we're going to raise this year for the 9-valent HPV vaccine called Gardasil 9. So in the past, it's only 4 of the vaccines that the vaccine can only sort of like prevent 4 types of HPV, which is the human papillomavirus, 16, 18, 31, and 33. Now we can do all 9. And our materials that we will share with you to say that now our aim is also not to vaccinate the girls, we're going to vaccinate the boys. It's a very ambitious program. But with the start of DG kicking us off, I have every sort of confidence that our people in the community is going to start accepting this program, the vaccine, number 1. Number 2, hopefully more sponsors will come on board and help us do this, because the vaccine is not cheap. They're short of this vaccine. At this time, Merck can't make enough vaccines for the first world. But we are the only first Caribbean country that actually had this program 10 years ago, and now we're the only country that's reaching out to them in the Caribbean, because I've been in touch with the Merck representative, and they're so excited to say that Cayman would be the first one to be able to sort of offer this Gardasil 9. So it's a very exciting couple of years for us and Cancer Society, but again, we still continue doing what we do, financial aid, early detection, screening, voucher program, and everything else that goes with it. So thank you for this opportunity, and I hope you ladies will spread the word about it once you know what the vaccine is about. Thank you.
Thank you very much, Dr. Yin. And then finally, we have Ms. Lisa Tastosian, who's a senior board member with the MS Foundation of the Cayman Islands. And I apologize if I got your name.
It's okay. It's Tatosian. Yes. Hi, everyone, and thank you for coming. I'm humbled and I'm grateful that you have chosen the MS Society as one of your charities. We are a young charity. We're 4 years old. Alyssa Christian, who is a Caymanian, found out when she was 26 years old that she had MS. And almost immediately what she did was form the foundation. That sends chills down my spine every time I tell that story, because a 26-year-old woman who has been given really a life sentence, immediately wanting to give back to her community is really an inspiring, and to me, the definition of just a great person. What the MS Society strives to do is to provide emotional and financial support to the patients that are on the island. We do this by not only reaching out to the community and helping them when they need to go to the doctor. We help with caregiving. We help with babysitters when they need that. We also help with therapy for the entire family. MS is a lifelong disease. There is no cure. You will never get over it. You never grow out of it. It's going to be there, and it's actually one of the costliest diseases that you can be diagnosed with. Last year, our foundation, when we had our annual fundraiser, we really pushed we were trying to educate the public on the fact that it's an invisible disease. In the beginning, it is, because a lot of patients only have their symptoms and only they feel them, but on the outside they look fine. So the name of our event has been for 4 years, Pretty on the Outside. but on the inside, the brain is short-circuiting. And for those of you who don't really know what MS is, it's actually an autoimmune disease where the myelin sheath in the brain starts to sort of deteriorate. The body attacks it, and then the nerve signals don't go where they're supposed to go. Studies have found that the earlier detection and the quicker you start treatment, that the better and the slower the disease progresses. But so far, there is no cure. We have opened a center. The grand opening of the center will be in a few weeks at Alexander Place, and this year's fundraiser will be at St. Pedro's on March 14th. We also have a 50-50 raffle. This will be our big fundraiser of the year. Last year we were pushing that it was the invisible disease. This year we are pushing that it is early detection. So many times MS is misdiagnosed, as many of these diseases are, and so people who've lived with it for a long time end up having a much lower, a lower quality of life. So where our funds would go to would be directly back into the public. Because we're such a young charity, we have a very young board, and we are working directly with the Kamanian people and hope to be represented on the BRAC very soon. So I thank you again for allowing us to be part of this. We're thrilled, and hope to see you at our fundraiser on March 14th.
Thank you very much, Lisa. And now I'm going to introduce and hand it over to Norman Klein, who is the incoming managing partner of Appleby. And as I mentioned earlier, we are just thrilled to have Appleby back on board again. They've been so supportive of our event over the years, and they've come back again as a platinum sponsor. So we're really, really grateful to have you back on board. Over to you, Norm.
Thanks, Jennifer. Having supported the DG's 5K Challenge in various capacities since 2015, we are ourselves very thrilled to be again involved as the platinum sponsor for the third time. This event has supported so many worthy causes over the years, and we've seen the DG 5K grow each year in terms of level of participation, funds raised, and community profile. We're confident that this trend will continue this year. We're pleased that another set of worthy charities will benefit this year, some of which we support directly, and all of which lend significant support to life-threatening illnesses that affect all of us. At Appleby, we are ourselves committed to fitness and fundraising. Within the firm, we are committed to staff well-being, and of course, we have a very active community support program, of which this event is a very significant part. We're happy to be involved, not just because of the many worthy causes that the event supports, but because it is a great event for our staff and their families to get involved in order to promote their own health and fitness goals. Again, Appleby is very proud to be the platinum sponsor for the DG's 5K Challenge again this year, and we look forward to making a contribution to a successful event.
Thank you very much. Yeah. So we've heard from our three charities, and you've heard about some of the issues that they're facing, some of the challenges they have. The tagline that we have for this year's event is helping today, protecting tomorrow. And we think that really captures the essence of what some of the work these charities are doing. So I'm now just going to turn over to the Deputy Governor for some closing remarks.
Thank you, Ms. Aaron. And thanks again for everyone for coming. I think you have heard from our charities. You can see that the tremendous work that they do, and that we can really make a difference in people's lives. We believe in the civil service that our purpose is to make the lives of those we serve better, and this is one of the ways in which we can do that by supporting charities that really make a difference in people's lives. Sincere thanks to Appleby for championing our cause and being there, Mr. Brian Hunter, and now you, Mr. Klein. I don't know if you're a big runner, but Mr. Hunter used to beat me every year, so we'll see how that goes.
I usually beat Mr. Hunter.
But there you go. So the challenge is on.
Yes.
But again, thanks everyone for making the last 6 Deputy Governor's 5K Challenge a success, and now it's 2020, and we're looking forward to an amazing turnout so that we can really give some good money to these amazing charities. So thank you, and I'm sure you'll have a few questions.
Yes. We do have some time for questions, if there were any questions from the audience. Wait for the microphone, please. There we go.
Dr.
Yes,
Ian,
Nancy.
I know you all do a lot of fantastic work. Specifically, the human papillovirus, the HPV.
HPV, yes.
What sort of cancers is that proven to
Right.
to cause now for the public?
Yes, it's very, very, very much related to the actual increase of ENT, ear, nose, and throat cancers. A lot of people don't really, see it as what is the cause of a throat cancer or tonsillar cancer. Now we've found that because we're doing biopsies on these people, we can actually, send them for testing for HPV. And almost 70% of throat and neck cancers are associated with HPV infection. Of course, it's made worse if you're an alcohol drinker and also smoking. Right, so that's one big one. Then obviously the original use for the HPV-4 was Gardasil-4 was realistically to prevent cervical cancer. And now those nations like Australia, Canada, Europe, and those countries which actually had initiated this program and almost like it's mandatory that you have this vaccine. They are now really in the last 5 years they've seen a decrease in cervical cancer and also HPV infection. So that's why it's also associated with obviously anal cancer. So those are the things that we don't talk about, that actually most of the cancers now we look at it is actually caused by infection. H. pylori is another one that causes stomach cancer. Again, one of those things we're trying to highlight, that cancer is not just genetic, it's an infection. And with the vaccine, as we know, that's the biggest control you ever has, the best thing in the world, because that saves lives, okay? Yes?
Chris, just wait for the microphone so we can.
Is that vaccine readily available to people who
Yes.
want it?
Yeah, so when we started that program 10 years ago, we just basically made it sort of available to the school kids, because the younger you are vaccinated, when you're vaccinated, the higher sort of antibodies you have. That's why the young kids, when they get sick, they get really sick, but they get well pretty quickly. Right, so that's how with the sort of history of vaccines, you want to get them as young as possible. Since all these, look at all our children, when they're born, they're immediately vaccinated. Right, so the immune system is very important. So the older you get, when we give you the vaccine, there's still a protection, because we have also, there are guidelines, and I can share that with you afterwards, that we vaccinate the young girls as young as 11 years old. Between 11 is the best time to get them to about 16 years old. Then there is a gap. But anybody over the age of 21, I've got girls who are just started, dating or whatever, they will wait until they're 24, 25, and they still will get the vaccine, and it still works. But what we're trying to do is create this what we call herd immunity. That's why we need to vaccinate both boys and girls.
Yeah.
Yeah, at that time we only had money or funds to vaccinate the girls. The girls were more susceptible because of the cervical cancer. But now, boys, we know is part of it. Just like we vaccinate rubella, which is German measles, we vaccinate boys and girls. We don't differentiate that. So this is where I think education comes in. So, if anybody is worried about the vaccine, we have now 10 years of studies on it. We know it's safe. A lot of stories went on about the HPV vaccine in the past, about how people were getting autism, girls were having fainting attacks. But now, 10 years down the line, what we're seeing is what we're getting the best is the prevention. We do not detect HPV in the pap smears.
Older men and women, if they're worried, can they get it?
Yes, you should speak to your healthcare provider, because again, there are certain things that...
But
if
it's
you have-
not just for young people.
No, it's not.
Okay.
Okay, but the younger you are, the best buck for money, as I call it, because you're really producing the antibodies. So as you get older, there's some chronic disease, chronic conditions you may have, and so you may not respond as well if you're measuring the antibody. Okay, but still remember, when you're older, we say please vaccinate yourself before the flu vaccine. So give a big push to the flu vaccine, pneumococcus, which is the pneumonia vaccine, shingles, big one, all coming back, and shingles and HPV are family. So vaccines have come back to the forefront because a lot of people dipped in the 70s and 80s, and now that's why you see a research of people having measles. Okay, that really caused problems. So I'm using this platform as a push for vaccines, but
Go ahead.
I think education is really important. Talk to your healthcare providers. Cancer Society is always there. We can't answer your question. We'll direct you to the right resources.
Thank you so much.
Any other questions? Well, I want to thank everyone again for coming today. Again, huge thank you to Appleby for their support. We have a number of other sponsors who are already on board. I'm really happy to say that we have Butterfield, EY, the Credit Union in Davenport, who have all come back on board as gold sponsors. Cineco are back on board again as our halfway mark sponsor, so you can look forward to seeing their team cheering you on as you make your way around the course. We have PwC, who are back on as our WaterStop, one of our WaterStop sponsors. We have Walkers, Stepping Stones, Dentons, Chris Johnson and Associates, Affinity Recruitment, and Genesis, who are all back on board again as silver sponsors, and Foster's is a kilometer mark sponsor. There are still some sponsorship opportunities available, so please, if you would like to get involved in supporting the event, whether it's with financial or in-kind, you can reach out to supportdg5k@gov.ky and let us know how you'd like to get on board. Remember the dates. April 5th, we're in Cayman Brac. April 19th, we're in Little Cayman. And April 26th, we're here in Grand Cayman. And registration opens on March 1st on Cayman Active. Huge thanks to Cayman Active for continuing to support us with that. Don't forget, if you're on Facebook, to find our Facebook page and like us and follow us. And while you're out there doing all your training so that you can beat the Deputy Governor in the race, don't forget to post your photos using our hashtag DG5K Challenge. Thank you very much. We look forward to seeing you all at the event while we're helping today, protecting tomorrow, raising funds to support the Alzheimer's and Dementia Association, the Cayman Islands Cancer Society, and the MS Foundation of the Cayman Islands. Thank you very much.
Thank you.